Hello, my name is Chavis Little. I'm currently an occupational therapy assistant. I graduated from Brown Mackie College back in 2015. For my level 1 fieldwork experience, I was very nervous when I first started. The first day I had no idea what I was going to do. Then my clinical instructor, we broke everything down from day 1 to the very last day, what we were going to do, what we were going to learn. And after that, I felt very comfortable. The staff made me feel welcomed. I didn't feel like I just had one clinical instructor. They all helped me learn and make me grow as I was going. My clinical instructor made sure if we had free time one day after treating, we would sit down, we would go through all the modalities, all the assessments that I would be performing on my own time. He made sure I understood each and every one of them, and if I had any questions, we worked all the way through them. He did that with the first week of my field work. And then the very last week, we went through them again to make sure I improved and made any changes that I needed from the very first week. When I was going to school, all we focused on was the occupational therapy aspect of treating. We didn't really talk about the physical therapy or the speech therapy. But when I started my level 1 field work, I got to see the other disciplines. I even got to work alongside some of the physical therapists and the speech therapists. And it just gave me a completely different understanding of how to work with everybody and to do what's best for my patients to get them to complete their goals, either to go home or to stay here at a long-term care facility and live a stronger, healthy life. After I had graduated from college, I was looking all over the place to find a full-time job. I actually got a call, leaving an interview, I got a call from my clinical instructor asking if I was interested in a job, and of course I told him yes. And we just, within the next week, I believe, I had an interview with the regional manager here, and then the following month I started working full-time. After working my first field work from HTS, I already had the basic concept of how to do the computer work, the charting. I had the basic layout of what I was going to do with the patients, what they expected, and how it all intertwines together, and I felt extremely comfortable coming in here working full-time for HTS. I think it's very important for every therapist to attempt to take in a student at least once to make sure there's a future for the job to keep going and progressing. And after I've have enough experience being a CODA for a year, I plan on taking in trying to train a student at least once. That way I can kind of pass on my knowledge, and being a new CODA, I know how they're going to be feeling coming into their first field work and kind of help them feel at ease and teach them everything I've learned. I think the benefits of taking on a student, you get to pass on your knowledge, and as they're growing, they can take in what you've taught them and make it their own to become a better occupational therapy assistant.